There we go, we're on one. Hi everyone, Dr. Rich Castellano here. We're here today with Penny. Thank you for letting us share your treatment today.
You're welcome.
We're going to be doing a little bit of the Sculptra. Now she has some bruising because we did eyelid treatment, because she was in the Super Bowl. That's why she has some bruising. We did some upper eyelid treatments, and the bruising is gravity. So even though we didn't do anything down here, the bruising comes down. And as we get older, sometimes the skin can do that. So I just want to show you, she's 1 week from her upper eyelids, and this is where we started, so you can see how that eyelid skin can really sag down. And if you look now, if I zoom in, you can see she's really got a lot of improvement for that. Now she's still a little swollen yet, so this isn't her final result, but very proud of Penny's results. And Penny, you did not take any pain medicine. You say you took some Tylenol?
I took one Tylenol, that's about it.
Okay. How was your treatment overall for the eyelids? How was it overall for you?
Yeah, overall it was wonderful.
Oh, good.
Yep.
And so today we're going to do a little bit of the Sculptra, which under the eyes we get the hollows, and so we're just going to fill in those areas. And I'm just going to make this little adjustment here, and Yesenia has everything set up perfectly for us. So, Penny, what was it that inspired you to have a cosmetic treatment done?
The eyelids were coming down onto my eyeballs, and my vision was impaired.
Got it.
So that's why.
Very good. And the way we do it now is you don't need to take muscle and fat, you just take the skin only, and that's less recovery. And as we age, we know we're going to hollow out around the eyes, so instead of hollowing, let's leave as much volume as possible. So we're glad you had a good experience. Now, when I do the Sculptra, I use this numbing medicine, and you'll feel this little pinch here, Penny. So you feel buzz, and then pinch on 3. 1, 2, 3, pinch. You feel small, medium, big pinch, not too bad. You doing okay?
Yep.
Was that a small, medium, or big pinch?
Small.
Small pinch, okay. Little pinches. Same thing on this side. Buzz and pinch on 3. 1, 2, 3, pinch. Small, medium, big pinch, not too bad?
Small.
Okay. Sculptra is a superior collagen stimulator, and we have a lot of our patients that avoid lower eyelid procedures because they just do the filler. And patients like that when they can avoid surgery whenever needed. You feel a little bit of a pinch there?
No.
Not really? So thank goodness for lidocaine. And she's a tiny bit swollen from the eyelid procedure, but we're doing the Sculptra today. Little pinch, 1, 2, 3, pinch. Is that a small, medium, or big pinch?
Small.
Small pinches, okay. So now with the Sculptra, I've mixed in, you can see the Sculptra, right? There's in suspension, and then I use this 25 gauge cannula, twist technique. I'm going to have you turn your head just a little too, there you go, thank you very much. You feel a little pressure pinch,
Yeah.
and then you'll feel a little numbing medicine. Tell me what you feel now, pressure, pinch, or a little bit of both?
A little bit of both.
Small, medium, big pinch?
Small.
It'll start to feel a little numb and goofy under your eye. And you can see the little valley that she has there is already starting to soften. How are you feeling, Penny?
All right.
If you need a break, you let me know. I'm not in a hurry, okay?
Okay.
Penny's tough. How about now? Do you feel any pain?
No.
Me neither. Everything's looking good. So there's lidocaine inside of the Sculptra that we mix in. So that makes it much more comfortable. Yesenia, can you just hold a little pressure there, please? We'll just hold a little pressure on that spot. That reduces bruising when you hold pressure. Sometimes you'll hold and then check and see if it's bleeding, but you can't just keep checking. You gotta hold that pressure for a little while. Same thing on the other side. Now, normally from the fillers, people aren't going to bruise that much, pressure pinch, but she had some bruising from her upper eyelid procedure, so it's not totally a surprise if that does happen. Everything's looking good. How about here, Penny? Small, medium, big pinch? So little pinches, and pretty soon she'll feel nothing because that numbing medicine. And I like to be right anterior to the orbital rim with the Sculptra. It's a very good filler. You need to make sure you are injecting very, very small amounts over a large area. Okay, thanks, Yesenia. I will mix, or my team will mix the Sculptra right before you inject it because it can settle. So you want to make sure you have the most even distribution of the Sculptra. Penny, do you feel a little pinching here or not really?
No.
So now that she's numb, she doesn't feel what I'm doing, and I use the shiver technique so I can put a very fine amount of filler over a large area. The bulge you see is the fatty pocket, so our goal is to fill the valley underneath. And also the collagen stimulation of the Sculptra, that feel a little something there, that will tighten and firm a little bit under the eyes. You'll feel a little pinching here. Everything's looking good. Perfect. How are we doing so far?
Very good.
We're not in a hurry. If a patient ever tells me they need a break, we just take a break, but really they don't ask for it. They say, no, I'm doing fine. Pressure pinch. Thank you for watching. Thank you for sharing. We're in Tampa and the Villages, Florida. We're wearing our 3M VersaFlow Pampers. It is safe to get the vaccine with fillers. There's no contraindication for the filler. We do recommend getting the vaccine. I've had my 2 doses.
Did you have any?
I may need another
Anything
can.
happen? No.
No, I felt pretty good. The day after the 2nd dose, I felt, you feel a little, I felt a little under the weather, but I still worked and didn't have any problems that way. Everything's looking good. Perfect. How about here? Do you feel any pressure or pinch?
No.
Very good. So this is Sculptra under the eyes. Just have it available, please. Now with Sculptra, you'll see a result and then it goes away 100%. So Penny has some good volume in her cheeks to begin with, but we're focusing right in this area. So even if I don't inject anything, she'll have a little swelling just from me passing the cannula. So that's why you don't want to taste the chocolate cake before it's done baking. We'll pressure pinch here. Very good. It's very normal that we lose volume as we get older. So all my job is just to put back what was already there. And if you want to look natural, just stay within those boundaries. That's why we talk about our ABCs of plastic surgery. When you know the ABCs, you will make better decisions. A stands for areas. How are we doing, Penny? You doing okay?
Very good, thank you.
Very good. Penny's tough. We try and make it easier than the dentist's office. So the ABCs of plastic surgery, A stands for area. There's 4 areas that we address to improve the facial appearance. If we sag, we tighten, and we did some tightening on the upper eyes. If we lose volume, we fill. Sun damage, wrinkles, and sunspots, we can polish and repair the skin. The 4th area is better than everything else. That's our behavior. A little pressure pinch there. And nothing looks as good as Mother Nature's free facelift when we smile. And Penny has a great smile. She knows the power of smile. Looks like Sue's coming from the UK. Hello, Sue. Thanks for watching. Let us know if you have any questions. Very good. How about here? Any pressure pinching?
A little.
Feel a little pinching or pressure or both?
Both, just a tiny bit.
Just a tiny bit. Not too bad, huh?
No.
Easier or more difficult than the dentist? Thank you. Perfect. Little more to go, then we're done. No restrictions afterwards. I like to recommend 5-minute massage 5 times a day for 5 days.
How so?
So there's no restrictions. You can't hurt the product. So we're doing some Sculptra under the eyes, collagen stimulation. We got her stitches out as well. And after the eyelid procedure, then it's just a matter of splashing with water and not using too much soap. We don't want to soak afterwards. And then in another week, there's no restrictions at all, but you just need to be careful this first week afterwards doing the upper eyelid procedure. And now we're on to the fillers. If we're lucky, aging keeps coming for us, better than the alternative. So Penny still has many active years ahead of her.
I do. My mom lived to age 95.
There you go. So today, Penny will pass the grocery store test. She walks into the grocery, nobody really does a double take, but she will be just a tiny bit swollen, and then that's going to go down. And then when the swelling goes down, the collagen's going to build. And usually at around 6 to 8 weeks is when I like to take some pictures. And at that time, Penny will say, hey, I like it, or she'll say, you know, maybe a little, maybe if you want to add a little more, we can add more. This way she's in control and we don't go too far. And Yesenia had everything set up perfectly, made it very easy. Thank you, Yesenia.
Anytime, Doc.
We've got some ice for Penny while we're wrapping things up here. Okay, so I really like what I see where you saw those bags from before. I'm going to do some massage right now. And so there's a little bit of the... So, Penny, this is how I do the massage. You're going to press on the cheeks. Up, down, side to side, back and forth. You can't hurt the product.
Okay.
Is that tender when I push or not really?
Not too bad, no.
So you just take it easy. You can push right up against the bone. Now, open your eyes for me. So a tiny bit of swelling, but can you see how the bags soften when we feel that valley?
Yes.
Okay, so the bags improved quite a bit. And I'm going to show you some pictures. Now, she has some bruising because 1 week ago we did the upper eyelids. But I don't expect it. She may get some bruising from the Sculptra, she may not. But then I'm going to show the pictures from before where you can see that how prominent the bags were. So if we fill in those bags, right now she's a little extra puffy, but you don't see the hollow. So this is what you expect from a treating under eyes with the Sculptra, that it's going to be a little bit swollen. This isn't the final result. Make a big smile for me, big smile. She's got a great smile to begin with. So that wasn't too bad. You can relax now. That wasn't too bad with the Sculptra, was it?
Not at all.
Okay, so I'm going to see you back at 6 to 8 weeks.
Okay.
There's no restrictions in your activity with the Sculptra. Just take it easy for another week with the upper eyelids. You call if you have any questions. Are there any questions that I can answer?
How often do I put the ice on?
The ice, you can ice just for today. When these warm up, you don't need it. Some people like to ice, and they'll use that. But it's not mandatory to have the ice, so I'm going to zoom out a little bit.
And how often do I massage?
5 minutes, 5 times a day, for 5 days.
Okay.
Okay? Congratulations. Yesenia's going to set up your appointment. I give you the hugs and hugs from here. Thank you all for watching. Thank you, Penny.
Thank you, doctor.
You're very welcome. We're here to stop bad plastic surgery and show you how to do things the right way. We'll see you in the next video.
Bye.